everyone. So today in this video we'll be studying about diabetes. It is a very common disease nowadays. So it is a group of disease that result in too much sugar level in our blood, which means कि हमारे blood में sugar level बहुत ज़्यादा बढ़ जाता है, जिसकी वजह से हमारे cells को enough energy नहीं मिल पाती है to do their work. As our cells need energy and glucose in a source of energy for them. So डायबिटीज़ मेलाइटिस में क्या होता है कि हमारी बॉडी में जो ग्लूकोज है यानी जो शुगर है वो ब्लड से सेल्स में जाने में दिक्कत आती है उसमें, एंड ड्यू टू दिस हमारे ब्लड में ग्लूकोज लेवल बहुत ज़्यादा बढ़ जाता है और वो हमारे सेल्स तक नहीं पहुंच पाता है, and then cell starve for energy despite of having glucose in blood, but it can't move to cells. Generally our body controls how much glucose is in blood relative to how much get into the cells by two hormones, that is insulin and glucagon. Insulin is used to reduce the blood glucose levels and glucagon is used to increase blood glucose. And both of these, insulin and glucagon, are produced by a cluster of cells in pancreas called islets of Langerhans. And insulin is secreted by beta cell in the center of islets, you can see in the picture, and glucagon is secreted by alpha cells in periphery of islets. Now, insulin reduces amount of glucose in the blood by binding to insulin receptors in the cell membrane of various insulin responsive tissues like muscle cells and adipose tissues. And when activated, the insulin receptor cause vesicles containing glucose transporter that are inside the cell to fuse with the cell membrane, allowing the glucose to transported into the cell. And glucagon does exactly the opposite. It raises the blood glucose levels by getting the liver to generate new molecules of glucose from other molecules and also breakdown of glycogen into glucose, so it can all get dumped into the blood. Now let's talk about the types of diabetes. There are two main types of diabetes, that are type 1 and type 2. Type 1 mainly constitute 10% of all the patient and type 2 constitute 90% amongst all the patient. Type 1 is a chronic condition in which pancreas produces little or no more insulin, and it typically appear in the adolescence. 20 to 30% it can be hereditary and the symptoms are of short duration. And type 2 diabetes, your body isn't able to effectively use insulin to bring glucose into your cells. Also, it is called adult onset diabetes and it is 90% hereditary. Symptoms may present for months or years. And some other subtypes of diabetes mellitus are gestational diabetes, when pregnant women have increased blood glucose, which is particularly during the third trimester, and cause is thought to be related to pregnancy hormones that interfere with insulin action on insulin receptors. And second is drug-induced diabetes, which is which can be a medication side effect that tend to increase blood glucose level. Now coming to the symptoms of diabetes, you will see all the symptoms in both the types. So the symptoms are excessive thirst, fatigue, weight loss, blurred vision, frequent infections, slow healing process, red swollen tender gums, chronically dry itchy skin, hunger, sweating, nausea and vomiting, fast heart rate, headache, sleepiness, and the main symptom is smell of acetone in your breath. Now coming to the important part, and that is diagnosis, कि आपको पता कैसे चलेगा कि आपको डायबिटीज़ है, आप कैसे पता लगा सकते हैं. ये कुछ टेस्ट यहाँ पे दिए गए हैं जिनके थ्रू आप पता लगा सकते हैं कि आपको डायबिटीज़ है कि नहीं है. और ये आपके ब्लड टेस्ट करा जाता है, तो आपके ब्लड में जो ग्लूकोज लेवल है वो चेक करा जाता है, एंड इट हैज़ अ स्पेसिफिक स्टैंडर्ड्स दैट वर्ल्ड हेल्थ ऑर्गेनाइजेशन यूजेस. एंड वेरी फर्स्ट कॉमन टेस्ट इज़ अ फास्टिंग ग्लूकोज टेस्ट, which is taken where the person doesn't eat or drink for 8 hours except water and has their blood tested for glucose levels. And the normal level is less than 100 mg per dl. If it is between 100 to 125 mg per dl, it is considered as pre-diabetic. And if it is more than 126 mg per dl or higher than on two separate test indicate that you have diabetes. And second test is non-fasting or random glucose test, which can be done at any time, and its normal value is 80 to 140 mg per dl, and if it comes between 140 to 200 mg per dl, then we can consider the patient to be pre-diabetics, and if it is more than 200 mg per dl, we consider that person is suffering from diabetes. Third test is oral glucose tolerance test, where person is given glucose and then the blood samples are taken at time intervals to figure out how well it's being cleared from the blood, and the time interval is of 2 hours. If the levels are between 140 to 199 mg per dl, it indicates pre-diabetics, and if the levels are above 200 mg per dl, it indicates diabetes. Another thing to know is that when blood glucose levels get high, the glucose can also get stuck to protein that are floating around in the cells or the blood. And that brings to another type of test called HbA1c test, which means the proportion of hemoglobin with glucose stuck to it, called glycated hemoglobin. HbA1c levels of 5.7 to 6.4% indicate prediabetes, and above 6.5 and more indicate diabetes. And another test is C peptide test. It is a test for the byproduct of insulin production, and if the level of C peptide is low or absent, it means the pancreas is no longer producing enough insulin and glucose can't enter into the cells. Now, coming to the treatment in diabetes, and it is controlling blood sugar level through diet, oral medication or insulin is the main treatment, and regular screening for complication is also required. Treatment in type 1 aims at maintaining normal blood sugar levels through regular monitoring, insulin therapy, and diet and exercise. Diet advice provided by a nutrition expert to prevent and treat diseases, and aerobic activity for 20 to 30 minutes 5 days a week. And in type 2, treatment include diet, exercise, medication and insulin therapy, and quitting smoking and tobacco. Diet advice provided by a nutrition expert to improve or treat disease. And also aerobic activity included. Also it can be exercise for 20 to 30 minutes daily. In type 2, with a healthy diet and oral anti-diabetic medication like metformin and several other classes can sometimes be enough to reverse some of that insulin resistance and keep blood sugar levels in check. Along with the treatment, it is very important to avoid or limit the following things in diabetes, which include dried fruit with added sugar, fruit drinks, fruit juices, pickles that contain sugar or salt, trans fat, white bread, pasta, rice, sweetened breakfast cereals, jam, jellies, and other preservatives with added sugar, alcohol, and tobacco. And along with prevention, you can add these food options in your diet for controlling your diabetes. First, it is fatty fish, which contain omega 3 fats that reduce inflammation and other risk factors for heart disease and stroke. Second is leafy green vegetables, which are rich in nutrients and antioxidants that protect your heart and eye health. Third is cinnamon, which may improve blood sugar, control insulin sensitivity, cholesterol, and triglyceride levels in type 2 diabetes. Next are eggs, which protect your eye health and keep you feeling full. Then chia seeds, which contain high amount of fiber and are low in digestible carbs and may decrease blood pressure and inflammation. Greek yogurt, which promote healthy blood sugar levels and reduce the risk factors for heart disease. Then nuts, which are healthy in addition and low in digestible carb and help to reduce blood sugar. And this is everything about diabetes, its types, treatment, and what to eat in diabetes and what to avoid in it. So I hope you all will like it. And for such medical notes and other stuff, you can follow my page on Instagram. I will link it in description box. And thanks for watching.